Hello, my name is Michaela Smith, and throughout this presentation, we will be discussing gender dysphoria, what it is, how it affects those diagnosed with it, and the resources these individuals have. I chose to cover gender dysphoria as many people dear to me in my life are transgender. I also think that in today's climate, destigmatizing gender dysphoria is essential to allow the best quality of life for transgender individuals. But what is gender dysphoria? Gender dysphoria is described as a condition characterized by the ongoing stress and impairment in everyday function as a result of a mismatch of one's experienced or expressed gender and that of what they were assigned at birth. To be diagnosed with gender dysphoria, the DSM-5 requires that individuals experience at least two of the following symptoms for at least 6 months. A marked incongruence between one's experienced or expressed gender and primary and/or secondary sex characteristics, a strong desire to be rid of one's primary and/or secondary sex characteristics because of a marked incongruence with one's experienced or expressed gender, a strong desire for the primary and/or secondary sex characteristics of the other gender, a strong desire to be of the other gender, a strong desire to be treated as the other gender, a strong conviction that one has the typical feelings and reactions of the other gender. As for treatment of gender dysphoria, there has been much discussion and many concerns raised as to what the best treatment method is. Currently, professionals follow the WPATH standards of care for the health of transgender and gender diverse people. These standards are as follows. A thorough assessment by a mental health gender specialist who is knowledgeable about gender dysphoria and trained to make differential psychiatric diagnoses. For prepubertal youth, psychological support without medical intervention. After initial signs of puberty, some youth may be eligible for puberty blockers. Individuals post-puberty may be eligible for feminizing or masculinizing hormone treatment, with adults also given options for gender-affirming surgical procedures. So long as the individual has completed at least 1 year of hormone treatment, are satisfied with the results, and are certain of their desire for surgery. The study of intersectionality within gender dysphoric/transgender individuals is a subject only recently receiving the attention it deserves, leading to definitive data on how intersectional diversity affects the self and one's microsystem to be sparse. There is evidence of a connection, however, of transgender POC individuals being unable to find adequate medical care for gender dysphoria. In the qualitative study of the barriers that transgender and Latinx immigrants face accessing mental health services in the U.S., Lee and colleagues described how intersectional, interpersonal, and structural processes, mainly interlocking racism, cisgenderism, and nativism, shaped participants' healthcare experiences. Findings show that participants lacked access to healthcare facilities that provided services in Spanish, accepted their insurance, or employed providers who were both competent in hormone therapy and respectful of patients' gender identities and how they preferred to be addressed. Studies also show that POC transgender individuals are subject to more violence than white transgender individuals, with black transgender women making up more homicide cases than that of black cisgender women. Transgender individuals and those with gender dysphoria also face legal challenges in today's era, with multiple Ohio laws preventing access to gender-affirming care for many individuals, primarily gender dysphoric youth. These are actual laws that Ohio residents currently face. Ohio Admin Code Rule 5160-2-03 says Ohio Medicaid does not cover gender quote-unquote transformation. HB 68, which was made in 2023, prohibits gender-affirming care for minors, requires schools, state institutions of higher education, and private colleges to designate separate single-sex teams in sports for each sex. SB 104, made in 2024, prohibits K-12 and colleges from allowing trans students to use a bathroom that doesn't correspond with the gender assigned to them at birth. There are many harmful stereotypes which gender dysphoric individuals face that create stigma for the disorder. This stigma can prevent those with gender dysphoria from being able to access affirmative care, but it can also discourage individuals from seeking a diagnosis altogether due to the stigma which surrounds it. Common stereotypes are that claiming to be transgender is a fad, a choice, a phase caused by peer pressure, or a form of rebellion. That someone taught their child to be transgender, or that their child might turn other children transgender in the family or community to be transgender. that transgender individuals could prey on women and children in public bathrooms, all of which are false. Within Columbus, we have Stonewall Columbus. Founded in 1981, Stonewall Columbus has served as a support system and advocacy center for LGBTQ individuals. Stonewall offers a community space for transgender individuals, information directory, gender-based counseling, and advocates for policy reforms in the state of Ohio. In conclusion, gender dysphoria is a disorder in which individuals' assigned gender at birth does not match that which they experience or express. Stigmatization of the disorder has led to many gender dysphoric individuals being prevented from receiving adequate care. In summary, I wish for you to have gained a better understanding of the trials transgender individuals face, and how they simply wish to have their outward appearance match their individual identity. These are the resources that I used. Thank you, and I hope you have a wonderful day.